I'd like to introduce to you our presenter for this session, who is Zeenat Moromoke from Nigeria. She's a chief research hospital, and the topic for this is to improve birth preparedness and complication readiness in. Yeah. Thank you, Zeenat.
Good morning, everyone, and thank you for joining this session for the International Day of the Midwife. I would like to sincerely appreciate my facilitators, Linda and Nancy, for this opportunity. My name is Zeenat Moromoke Abdulwahab, and today I will be presenting on effectiveness of culturally appropriate antenatal education package to improve birth preparedness and complication readiness in low and middle income countries, a systematic review. I will briefly take us through the background of the problem, the concept of birth preparedness, the methods used in this review, the key findings, and the implications for midwifery practice. Background knowledge. Maternal mortality remains a major global challenge, particularly in low and middle income countries, which amounted to about 211 deaths per 100 live births. This is driven by 3 delays. A significant proportion of these deaths are preventable and are linked to delay in recognizing the complications, delay in recognizing when to seek care, and delay in accessing the care when they get to the hospital. The 3 delay models help us to understand where each of them occur. The first one occurs at home, when the patient fails to recognize when to access healthcare. Then the other one is due to poor road network, when they fail to get to the healthcare facility at the desired time. Then when they get to the healthcare facility, they also encounter delay in receiving the adequate care demanded of them. Addressing these delays is critical for improving maternal outcomes. Next slide. In many low and middle income countries, antenatal education usually remains largely generic, didactic, and poorly aligned with women's socio-cultural realities, which contribute to persistently low birth preparedness and complication readiness indicators, despite relatively high antenatal attendance. Birth preparedness and complication readiness improves proactive planning for childbirth emergencies. This includes 1, identifying a skilled birth attendant, then saving money, arranging for transport, and recognizing danger signs. The role of antenatal education in this aspect. Antenatal care provides a key opportunity to educate women. However, in many settings, education is often generic, as I earlier said, and they are not tailored to the realities of women's life, and it limits its effectiveness. The aim of this study. The aim of this study is to synthesize evidence on the effectiveness of culturally appropriate antenatal education interventions on birth preparedness and complication readiness outcomes among pregnant women in low and middle income countries. The problem gap now. The problem gap, despite high antenatal attendance, many women are still not adequately prepared for birth. This highlights a gap between information provided and actual behavioral change. The methodology used in this study. This study was a systematic review, which was conducted using PRISMA 2020 and JBI guidelines. The protocol was prospectively registered on Prospero with the ID displayed on the screen. The eligibility, multiple databases were searched and only studies meeting strict inclusion criteria were selected. These databases searched include PubMed, Scopus, Web of Science, Sinai, and Google Scholar. Then the Boolean operators used in searching the key terms are displayed on the screen. Next slide. Yes, from over 1,002 records, duplicates were removed and studies were screened in stages. After the duplicate removal, 2 independent reviewers, that is Zeenat and Chika, screened the titles and abstracts. The data extraction. Data were extracted using the standardized JBI-based form. Then the quality appraiser, risk of bias assessment. Study quality were assessed using JBI critical appraiser checklist. Next slide. The included studies. The studies included in this systematic review include 11 studies, which run through 6 countries and 5,802 participants in the study. The studies, the interventions are facility-based education, community outreach, family inclusive program, and mobile phone messaging. The key findings. Next slide. Knowledge level improved up to 85%. The birth preparedness complication readiness improvement increased from 25% to 95%. The facility delivery rate also increased. Discussion of findings. In the study, there was a consistent improvement in women's knowledge. And this was demonstrated towards local sociocultural context. The cultural adaptation features included the use of local languages, context-specific examples, and engagement of their husband and other family members. The delivery formats were compatible with community norms by using group sessions, home visits, and mobile messaging. The implications for midwifery practice. Delivery of culturally responsive antenatal education through the use of digital tools, engagement of family members, and community involvement. This also made the implication for midwifery practice to play a central role in delivering this antenatal education. There is also a need for midwifery to move from the routine teaching to culturally responsive, women-centered education during antenatal sessions. In conclusion, next slide, culturally appropriate antenatal education interventions substantially enhance birth preparedness and complication readiness among pregnant women in low and middle income countries. This was a practical strategy for equity, access, and respectful maternity care. Next slide. These are my selected references. Thank you for your time.